This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Our episode today is called Amnesia. Want to know what disease affects both sea lions and humans? What toxin inspired a horror film and has also been used as a deworming agent? Then listen to find out. Today's episode is inspired by a few of my very smart middle school listeners and starts in California. A friend has invited you to stay with her on the coast in a large rental house where her extended family is gathered for a reunion, planning a weekend of eating, drinking, and hiking along the beach. You arrive in time for dinner, a seafood feast including oysters, mussels, fish, crab, lobster, and sushi. Seated around a large table, the family is laughing and catching up. Knowing you don't eat seafood, your friend passes you the vegetarian sushi rolls. You're sitting next to her grandfather, a retired surgeon. He regales you with stories about his time as a medic in the Vietnam War. A few hours after dinner, he retires early due to an upset stomach. At 4 a.m., you're frantically shaken awake by your friend saying something is wrong with Grandpa. He's been vomiting all night long. The family members were aware but not alarmed. Now, however, he's confused. You throw some clothes on over your pajamas and go to Grandpa's room. Concerned family members stand around his bedside. He's actively vomiting, so you grab some nausea medicine from your travel first aid kit and tell him to put it under his tongue. Once he stops throwing up, you ask a few questions. Despite having spoken to you for several hours last night, he doesn't remember who you are. You don't make much of this given that he's 85, but your friend looks shocked, saying his memory is normally extremely sharp. He then asks where he is and why he's not at home, clearly having forgotten they rented this house for the family reunion. This is definitely an altered mental status. You recommend taking him to the local emergency department. As usual, of course, you wouldn't be the ER doctor in real life, but fortunately, this is fiction, so Grandpa is your patient. The emergency department nurse checks his vital signs, noting a normal temperature of 98.5 Fahrenheit or 36.9 Celsius. His heart rate is 110 beats per minute, slightly fast. His blood pressure is 120/80 with a respiratory rate of 18 and oxygen saturation 100% on room air. You start his physical exam with questions to determine his level of orientation. He knows his name, and he knows he's in a hospital, but he doesn't know the date or the year. The rest of his exam is unremarkable, including clear heart and lungs, no abdominal tenderness, and a non-focal neurological exam with good strength. In summary, we have an 85-year-old man with an altered mental status, a mildly elevated heart rate, and an otherwise unrevealing physical exam. This scenario is very common in the emergency department, so you start your standard workup, including labs, a urinalysis to check for a urinary tract infection, and an EKG. I do a head CT for things like a brain mass and an infectious workup including a chest x-ray for pneumonia. Given the vomiting, I'd also probably check a CT abdomen pelvis looking for infections or a bowel obstruction. Generally, we'd expect abdominal pain in addition to vomiting, but occasionally in elderly patients, cholecystitis, infection in the gallbladder, or bowel obstructions present atypically with an altered mental status. You start IV fluids and order more nausea medicine. His heart rate improves into the 90s, and all of his results come back. His EKG and labs are normal, including his creatinine and liver function tests. His urine shows no signs of infection. His head CT is negative, as is the CT of his abdomen. Your phone beeps with a text from your friend. Several other family members have developed nausea, vomiting, and diarrhea. All are mildly ill, though, and no one else is confused. Maybe everybody got a stomach virus at the same time, but more likely this is a foodborne illness like food poisoning. You're glad you ate the vegetarian option rather than the seafood. Can we test for food poisoning? People love to come to the emergency department asking for this. We rarely do. Why? Yes, we can test for some infections in the stool, but the results take days to come back, so they aren't useful. And either way, most cases of bacterial food poisoning are mild and resolve. Like stomach viruses, with time. Antibiotics aren't routinely recommended. Your friend says Grandpa ate only cooked seafood, specifically fish and mussels. He didn't eat anything from the raw bar, having had a bad experience with oysters in the past. Question number 1. Properly cooked food rules out the possibility of foodborne illness. A, true. B, false. The answer is B, false. While cooking does kill most bacteria, it doesn't kill everything. More on this in a minute. Does our patient have food poisoning? Obviously, nausea and vomiting shortly after a meal, along with a history of other family members, raises concern. But have you ever heard of someone with food poisoning being confused? Probably not. His altered mental status is a real red flag here. Sure, an older person with a severe case of food poisoning could become altered. But this really isn't a severe case of food poisoning. He's only had symptoms for 12 hours, he hasn't vomited since the nausea medicine, and reports only 1 to 2 soft stools, no significant diarrhea. Dehydration can certainly cause an altered mental status, but again, his creatinine was normal and his heart rate came down with fluids, so he's not significantly dehydrated. The nurse calls you back to the bedside, concerned because the patient is now even more agitated. He points to the blood pressure cuff, asking what's squeezing his arm and telling you to take it off. This from a retired physician? Admittedly, he's a surgeon, and surgeons don't like using things like blood pressure cuffs and stethoscopes, preferring scalpels. But still, he doesn't remember what a cuff is for? This is not good. The nurse says the patient's been getting out of bed and trying to leave, meaning he no longer knows he's in a hospital. His mental status is really deteriorated on our watch in just the few hours he's been in the hospital. Worse, our workup hasn't even given us a hint as to the cause. Question number 2. What medical problems does our patient currently have? A. Amnesia. B. Dementia. C. Delirium. D. Psychosis. The answers are A and C. Amnesia is the medical term for memory loss. We don't use the term a lot. It's been kind of co-opted in a dramatic fashion by Hollywood, but technically any memory loss, and there are many different types, are amnesia. He's also delirious, meaning confused and disoriented. Dementia, like Alzheimer's, occurs slowly over a longer period of time. Psychosis includes seeing things that don't exist, like auditory or visual hallucinations. We need to come up with something, a working diagnosis at least. We have a bit of a dilemma here. Common things being common, if the whole family is sick with food poisoning, it's most likely our patient has food poisoning too. I like, in my practice of medicine, when the diagnosis falls in line with Occam's razor. Occam's razor is when all the symptoms fit with a single diagnosis. It's neat and elegant. It's what we do on the podcast, taking the patient's symptoms and narrowing them down to fit the single toxin. But I don't like this altered mental status, and I'm reluctant to dismiss it because I don't think it fits with a mild case of food poisoning. You don't need me to tell you many things causing an altered mental status are life-threatening. In real life, the patients haven't read the textbook, as we often say, and things are typically much messier, following Hickham's dictum rather than Occam's razor. Dr. John Hickam said the patient can, quote, have as many diseases as they damn well please, end quote. What now? The next step in the emergent evaluation of delirium and an altered mental status is probably a lumbar puncture or a spinal tap, putting us between a rock and a hard place. The lumbar puncture will diagnose meningitis, or more likely in our patient, encephalitis. I hear you saying meningitis is a life-threatening disease, just do the LP. True, but it's not that simple. An LP is invasive and, more importantly, difficult to do on a patient who won't cooperate and doesn't understand why they're undergoing a painful procedure. The patient himself can't consent as he's altered. You have a long discussion with your friend and the patient's wife and daughter about the risks and the benefits. The family decides they want the procedure. Fortunately, with the help of a little sedation, he's cooperative, and you send the spinal fluid to the lab for analysis. While awaiting the results, you admit him to internal medicine. A few hours later, the LP results come back negative. Good news, no sign of meningitis or encephalitis. Your friend calls you from upstairs crying. Her grandfather is having a seizure. Bad news, definitely. The internal medicine team gives him an anti-epileptic, seizure medicine, and orders an MRI and an EEG. As we've discussed in the past, epilepsy is common, typically beginning in childhood or young adulthood. New onset seizures in older patients are much more worrisome because they are typically a marker of other problems like cancer or infection. You speak to the internist and become even more concerned when he says it was a unilateral seizure occurring only on the patient's right side. He thanks you for doing the LP earlier. The negative result helps narrow down the causes. You check in with your friend about the other family members. Everyone is getting better and no one else is confused. We could talk at great length about differential diagnoses for altered mental status, vomiting, and focal seizures, but that would take all day. Let's focus in on the likely culprit, the seafood dinner. A foodborne illness remains likely, but this clearly isn't a typical case of bacterial food poisoning, so let's consider some other options. Is this an allergic reaction? Anaphylaxis causes nausea and vomiting, yes, but he doesn't have a rash, difficulty breathing, or anything else you'd expect. Seafood can carry Vibrio cholera. Yep, cholera causing profuse diarrhea. Remember the description of rice water stools due to cholera and arsenic? Our patient's main issue at this point is not vomiting or diarrhea, but an altered mental status, so no to Vibrio. Hepatitis A is found in oysters, for example, definitely causing vomiting, but also jaundice and elevated liver function tests, which he doesn't have. Scrombroid is caused by improperly stored fish. It causes flushing, nausea, vomiting, and abdominal pain. Interestingly, bacteria present in the fish break down histidine to histamine, causing the symptoms, which are typically mild and short-lived. Cooking doesn't stop scrombroid or another disease called ciguatera. Ciguatera, again from fish, causes generalized weakness, vomiting, and diarrhea. Patients develop an unusual and characteristic symptom, reversal of hot and cold sensations. Rather than improper storage, this disease is caused by a dinoflagellate, i.e. an algae, on the fish. Ciguatera doesn't fit, but dinoflagellates bring us to another group of diseases caused by harmful algal blooms. Question number 3. Time to pick your poison. Which of the following do you think our patient has? A. Diuretic shellfish poisoning. B. Paralytic shellfish poisoning. C. Neurotoxic shellfish poisoning. D. Amnestic shellfish poisoning. The answer is D. Amnestic shellfish poisoning. Each of these diseases is caused by different algae causing different syndromes. In the interest of time today, we're going to focus only on amnestic shellfish poisoning, also called ASP. It's caused by a microscopic algae, diatoms, also called microplankton, named Pseudonytzia. The organism produces domoic acid, the actual toxin responsible for the symptoms, including nausea, vomiting, diarrhea, dizziness, short-term memory loss, confusion, seizures, coma, and death. Interestingly, the risk of developing more severe symptoms of ASP after exposure to domoic acid increases with age and is more likely to occur in men. So what does domoic acid actually do? It binds to glutamate receptors in the brain, and if you recall from previous episodes, glutamate is an excitatory neurotransmitter. Domoic acid, amongst other things, prevents the glutamate receptors from closing, resulting in overstimulation, which is clinically manifested as seizures. Amnestic shellfish poisoning was first described after an outbreak in Canada on Prince Edward Island in November 1987 due to contaminated mussels. There's a very nice description of the epidemiological investigation published in the New England Journal in 1990 if you're interested. Domoic acid also causes neurons to die, and autopsies on patients who died in Canada showed changes in the hippocampus and the amygdala, regions of the brain associated with memory and learning. So back to our patient. Can you test for domoic acid? Yes, but not in a hospital lab. The right course of action would be to call the local health department about the outbreak and for help with where and how to send specimens for testing. The results won't come back in a timely fashion, as is typical with other toxicology testing. You ask your friend about the seafood. She says most of it was catered by a local restaurant. The mussels, however, an uncle found and harvested in a cove near the house. Uh-oh. Commercially raised seafood undergoes rigorous safety testing, so algal diseases aren't a risk. Foraged shellfish, of course, is another story. You speak with a physician at the local health department. He tells you there's an advisory not to eat seafood harvested from the local beaches due to the risk of algal blooms at this time of the year. In fact, many coastal areas post maps and schedules reporting the safety of foraging for different types of marine species. Question number 4. If the uncle harvesting the mussels had looked closely, he could have identified the algal contamination of the water. A, true, or B, false? The answer is B, false. These types of outbreaks are classically associated with red tides, where the algae overgrowths turn the water red. Other colors are possible, including yellow, green, and even purple. But clear water doesn't mean it's safe. Pseudonytzia, in fact, doesn't change the water color. Thus the term harmful algal blooms rather than red tides. These episodes are increasing as global warming increases ocean temperatures. How exactly does excessive algae in the water result in human poisoning? The answer is bioaccumulation. As bivalves, like oysters and mussels, filter the water, the algae accumulate and then are passed on to larger animals who eat the seafood like crabs, lobsters, birds, sea lions, whales, and humans. ASP and other algal poisonings are uncommon in humans, but algal blooms can make the water unsafe to drink, fish unsafe to eat, and kill marine life. Even the air can become contaminated, causing asthma exacerbations in susceptible beachgoers. Back to our patient. He has several more seizures, but eventually recovers and returns home. He continues to have short-term memory loss and has had to be reintroduced to his great-grandchildren several times. Your friend says he's been practicing with her photos and showing signs of improvement. The rest of the family recovered after a day of vomiting with no other symptoms. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings. If I've learned one thing from this podcast, it's wherever you find a toxin, you'll also find a medicine. Seaweed containing low levels of domoic acid in Japan has been used since at least the 9th century as an anti-helminth or a deworming agent. Toxicity isn't reported from medical use, presumably due to the low concentration of the domoic acid in the seaweed. As I said, ASP is a rare disease in humans. However, it's not rare in marine life. In 2023 in California, amnestic shellfish poisoning and domoic acid affected sea lions, contaminating their dietary staples of sardines and anchovies. The poor guys washed up on shore, altered, lethargic, confused, and having seizures. Many were treated with IV fluids and anti-seizure medicine. Domoic acid toxicity affects marine life from small oysters all the way up to very large animals like blue whales. Earlier, I mentioned the middle schoolers reading a short story which inspired this episode. It's today's pop culture consult and question number 5. What movie was based in part on a real-life domoic acid intoxication? A. The Birds, B. Jaws, C. Deep Blue Sea, D. Arachnophobia. The answer is A, The Birds. Alfred Hitchcock based his 1963 movie, The Birds, in part on the Daphne du Maurier short story of the same name about birds attacking a farmer. He also took inspiration from a real-life event in Capitola, California in 1961. Locals describe birds falling out of the sky, dive-bombing houses and cars, screaming like babies, and vomiting up fish. At the time, the cause was unknown. Later research in the 90s on preserved specimens revealed the birds had domoic acid toxicity from the fish. Researching the podcast, I was actually horror-struck by the descriptions of filming during the movie. Despite spending the equivalent of $2 million of today's money on mechanical birds, the on-screen appearance looked fake. So instead, 25,000 real wild birds like crows and ravens were captured. The poor birds bit and scratched the handlers and the actors. Apparently, whiskey was mixed with the birds' food to sedate them for some scenes. In others, birds were thrown at the actress Tippi Hedren for days, attacking and pecking her. Birds were even tied to her clothing during the filming. And as if that wasn't enough, the birds were infested with lice, which was transferred to crew members on the set. Yikes! The last question in today's podcast is about chronic exposure to domoic acid. It causes which of the following problems in sea lions? A. Epilepsy, B. Heart failure, C. Brain damage, or D. Behavioral changes. Follow the Twitter and Instagram feeds, both at PickPoison1, and you'll see the answer when I post it. Remember, never try anything on this podcast at home or anywhere else. Thanks so much for your attention. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available on the website at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Thank you. Until next time, take care and stay safe.
This podcast is a production of Unfiltered Studios. If you would like to know more about joining Unfiltered Studios, please visit our website at unfpod.com for more information.